It's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're moments away from bringing you a briefing from the South Korean health authorities on the COVID-19 situation here in the country. Very soon we'll cut into the briefing room with simultaneous interpretation for you in English, where the Director of Health Policy, Yoon is expected to give us the details on the coronavirus situation in South Korea, filling us in on the number of new infection cases seen as of Friday midnight. He will also brief us on what kind of efforts the government is making to contain the virus. And it looks like the Director General has taken to the podium, and it looks like he's going to start the briefing very shortly.
We also have sign language translation available. First of all, here is Mr. Young-rae with the explanation on the COVID-19 response here in South Korea. Let us now begin our regular briefing for October 16th, Friday. As of today midnight, we have a total of 41 new local infections, and among them 36 are in metropolitan area and 5 in non-metropolitan areas. And we have 6 new imported cases today, and as of yesterday we had 2 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. As of now, domestic cases, we do not see a rapid decline in the domestic cases, and we have seen not a clear impact of the increase of the people moving around in the holidays and having effect on the increased number of confirmed cases. And we thank for the public's participation in quarantine measures. However, we still continue to witness cluster infections, especially centering around vulnerable facilities, including the nursing homes and nursing hospitals. Currently, we have seen a downward trend in the number of cases, and we have a clear increase in the level of capacity, our medical capacity to control the virus to a large extent. And as for the critical ill patients' beds, we have about 58 beds that are available out of some 70, and currently we have a total of 135 beds available for these critically ill patients nationwide. And we have seen the virus to infect some of the senior citizens, and we have known that these have been leading to a large number of critically ill patients. And out of the 97 critically ill patients beds, even if we have about 100 critically ill patients on a daily basis, on a weekly basis, that is, we will have a stable supply of our beds going forward. And also this will also enable us to manage the situation even if we have up to 200 critically ill patients going forward. And we believe that the number of people with severe or critical conditions are very important, and also it is very important that we have a sufficient number of hospital beds to treat these patients. And going forward, we will also secure about 600 hospital beds for the intensive care units going forward. And as for the large outbreak, we have some compensation plans for the cancellation fees for travel and air flight, as well as dining and accommodations. And we will also, starting from the 14th of October and until the 23rd, we will be looking at these situations in detail, and they will also look into various conditions, including the ability to compensate for these consumers, and we have laid out specific guidelines. As for tourism and accommodations, we will have a service about 50% of the decrease of the fees that can be covered by the government, and we also have provided about 20 to 30% decrease in the amount of compensation for other services like dining and so forth. And going forward, we will also help help to ease the conflict between the consumers as well as business operations going forward. And as for the foreign sailors who are coming into Korea through diverse ports, we will be intensifying quarantine measures. And as for the sailors who have been coming into Korea from July to August, we have been intensifying quarantine measures to contain the virus spread from these people. And as for the countries with high risk of infections, we are also mandating all of them to submit a negative PCR document. And also all of the people who are offboarding from these boats, we are carrying the diagnostic testings for all of them. And as for the related people and sailors from high-risk nations, we are carrying out the diagnostic testings for all of them, regardless of whether they are offboarding the boat or not. And we are also mandating them to wear all the protective equipment as well. And as for the foreign imported cases that have been confirmed positive, we are also asking them to pay for their own treatment costs. However, with the COVID-19 spreading through countries worldwide, we are also seeing an increase in the people of confirmed cases coming into Korea through ports. And to this end, we will be intensifying our quarantine measures to this end. And as for the countries from the high-risk nations, we will also limit the change and transition of these sailors. And even if we give them approval, we will be carrying out testings for all of them. And during their stay here in Korea, we will be intensifying our diagnostic application review and inspections going forward. And as for the local facilities that conduct the PCR testings, we will be intensifying and making sure that these facilities have high level of credibility. And if this person has submitted false or false documents, we will also be prohibiting all of them from coming into Korea. And we will also intensify our quarantine measures for imported cases. And all of the people coming into Korea have to face 14 days of self-quarantine. And we are also carrying out diagnostic testings on all of them. And as for the people who have been tested positive, and as for the countries with high level of positivity rate, we are intensifying quarantine measures by categorizing them as high-risk countries. And a lot of these cases are being identified at the points of entry, and we are also successfully containing the risks of possible spread through these people throughout the community. And therefore, we will also adjust the social distancing measures going forward, and we believe that these imported cases is not a factor that is factored in when we adjust the social distancing measures here in South Korea. Looking at the trend of outbreak, we need to separate the numbers of domestic cases from the imported cases. Starting from this week, we believe that many people will be resuming their social gatherings and travel as well as other events. And we believe that we will have an increase in the people of movement as well as people going on outings. And it is therefore more important for the people to comply with quarantine measures. We ask you to refrain from visiting multi-use facilities and also wear face masks at all times, and also abide by quarantine measures that are mandated by each of the venues. And please also strictly continue to follow with the hygiene measures. And please also refrain from going to gatherings with more than 50 people indoors and 100 people outdoors, and always wear face masks when you are at such gatherings or large-scale rallies. As for the large-scale rallies in Korea, in Seoul, scheduled for this week, we will be limiting the number to 100 so that we can contain the virus going forward. And due to the chilly weather lately, we have seen similar symptoms like COVID-19. And if you have related symptoms like fever or respiratory symptoms, please do not go to work or school, and please get tested as soon as possible. Thank you very much.
Well, that was a live government briefing on the COVID-19 situation here in South Korea. And it looks like the Ministry of Health and Welfare had a very last-minute change to the speaker. It was supposed to be Director of Health Policy Yoon, but they changed the spokesperson to Ministry spokesperson Young-rae. And Young-rae just told us that there were 47 new cases of COVID-19, bringing the total to 25,035. There were unfortunately 2 additional deaths, bringing the death toll to 441. That wraps up our coverage of this morning's briefing. We will be back there at 12 p.m. Korea time with our regular newscast with Mark Broom. Bye for now.